or the normal sequence for scooting. So elevate the pelvis, elongate on the weight-bearing side, rotate and forward on that pelvic half so they can see forward. So here I need to be sitting at the edge, and I need to kind of stay out of her way because you push people over. Because as she comes forward, what's going to happen? Right? We are going to get close, so I might need to move back or adjust at that point. So I'm having her hands on my shoulders just because I want you to see what's going on. What would be a rationale for you to put someone's hands on your shoulders if you're going to do some trunk work like this?
Elongation.
What?
Elongation.
Well, it's to get their, if they're really like this, and you put them into weight bearing and they're still slumpy like that, you might put their hands. So I need it to be here, okay? And now I'm going to say her sit up tall. So right from here, I got this. I'm going to take these two fingers, and I'm going to say lift this up, and then scoop. And then I'm going to say lift this up. And she's moving, I'm moving back. Okay, that's good. Now we're going to go back. Going back, I'm going to put my pinky in the front. And lift up and back. Lift up and back. Lift up and back. Lift up and back. Good. Okay, so going forward. Okay, lift up. These two fingers lift up and then forward, right? And with this, what are you doing with this hand if you need to? Elongating a little bit if they need it. Did she need it? No, I didn't do it. Don't do anything extra, right? She didn't need that. She was really nicely elongated on that side. And then going back, put your finger in the front, up and back, right? Up and back. So I'm going to ask you an interesting question now. How much clearance did Neha need to do this motion? A lot or a little? Really teeny. So usually we think about scooting, we think we have to do this. Sorry, we have to get the patient to do, just crush hands with this. We have to get them to do this, and then we do that. You know, and you'll see this a lot. What you'll see, what you see is therapists, they grab the butt and they do this. They lift that up, and they do that, right? I want to crush your hands again and just scoot forward for a second. How much does she have? It's not a lot of pelvic elevation. It's really a little bit. And I'm saying that, you can relax now, because there are going to be patients who you're going to think you have to, you know, they might be big, they might be stiff. You really don't have to get that much clearance for them to be able to move their sit bone forward and back, to translate their sit bone. You know, it's probably like how much a foot clears the floor by. You probably need like a centimeter or two, right?